All right, good morning, everyone. Looks like we're live on Facebook. We're live on YouTube. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. And today we're joined by Kathy, and we're discussing migraines. Good morning, Kathy.
Good morning, Dr. Gates. Good morning, everyone.
Okay, so did you want to open up today, Kathy? Or what were the items on the list?
I really think I'm the poster child for headaches. Have had them since I can remember, and I have memories clear back to when I was 3, so I can't remember a time when I did not have headaches.
Wow.
And just to kind of jump forward, then they never improved until I worked with you and did your program that you set up for me, changed my diet, exercise, different things that I did.
Yeah.
But since we've done that work, then you and I have both kind of gone back and looked at causes. My childhood was awful.
Right.
Headaches all the time that I always thought was tension.
Okay.
I told you I remember even being a little kid going to school, first week of school every year, a headache every day for at least a week.
Okay.
So I thought some about that. We always said it was tension. But then I started thinking, okay, now that I've done my work with you and know about gluten and dairy and all these other things, and I'm like, okay, what did we eat?
Right.
We had either cream of wheat or oatmeal or toasted jelly for breakfast.
Right.
Probably grilled cheese for lunch.
There we go.
Or some sort of sandwich, something with bread.
Right.
Or if mom wasn't busy with something else, then maybe you got a casserole or mac and cheese, something that had more, pasta or gluten kind of stuff in that.
Right.
That I still don't know that gluten was that bad back then because I don't think our food source had changed so much. But just reflecting back, but I told you last night, my mom's answer to all my headaches was that I was constipated.
Which I think was common back then. I've heard this from other people of your generation. It was like the cure for everything was to get rid of the constipation.
But after what I just told you what we ate, why wouldn't you be? Half a loaf of white bread and a bunch of cheese and pasta stuff. I'm not going to say she didn't fix the salads and fruits and vegetables. She did. She did a really good job of trying to follow the food groups that she learned in home economics back in the day. So that's what we ate.
Yeah.
And I think I went to a friend's house, they ate the same way. That's what we ate back then. But the constipation thing. So it was always, I was really good friends with Castoria and milk and magnesia and all these things. But none of those really gave me any kind of relief as when you and I started working together and you kind of turned me on to just regular magnesium, which is a great thing to keep people going.
Simple. Yeah.
But and nobody ever comes up with it. There's all sorts of expensive things that they want you to buy as a prescription to try to help with that.
Really good point.
But number one, eat better. Number 2, exercise more. And at the same time, that's not to say that tension doesn't cause a headache.
True, absolutely.
So if we think about it, my question was, what's the connection between, now that we know about our microbiome and our gut and all the stuff that goes on and how stress affects it, was my first week of school just one great big connection between my gut and my brain that would cause these headaches?
Right. Really great question, because if somebody is under stress, it's going to affect the motility of food going through their GI tract, leading to constipation. More constipation you have, more likely you are to overgrow bad bacteria in your intestines and your colon. And then pieces of those bacteria can break off and go into the bloodstream, creating more inflammation. Certainly that can be associated with headaches. There's a lot of research on this metabolomics, the short chain fatty acids and other byproducts that the gut bacteria make, and how that affects the brain and other parts of the body. So I'd say definitely there's a correlation, and it seems like it was probably very much food related and in part stress related. And the stress may not just be, what the stress is doing to the head, it can be what the stress is doing to the gut and thereby affecting the head. And certainly there are other connections between stress and muscle tightness and the cervical spine, and we'll talk about all of that as well. So that'd be my take. And you're getting a lot of good
Okay.
comments, Kathy, about the food, because people are chiming in saying they were eating TV dinners sometimes too. And yeah, I mean, this is reminiscent of the American diet. These are delicious foods. Oh my gosh, I miss grilled cheese like a lot. Now that you bring that up. But yeah.
I do it on gluten-free bread once in a while
Oh,
just to
that
give
sounds good.
myself a treat.
Yeah, that
But
sounds good.
I mean, but you need to do something. And yes, I mean, we all associate those foods with really good memories and so forth. But I mean, think about it. I mean, TV dinners. We're talking about even clear back, what we're late 50s, whatever. A processed food.
Right.
You know?
Right. Right.
So I mean, there's probably MSG in TV dinners, or at least back then there probably was. I mean, there was a lot of stuff going on that we thought was new and inventive and creative and something cutting edge that we were coming up with that was feeding us quickly and easily, but maybe not so painlessly.
You know, I'm glad you brought up the processed food thing, because one of our patients just brought up a book to me today, and if they can maybe chime in, not today, this week, but this book was written by a microbiologist, and she was saying that when we eat processed foods, we release more glutamate, and glutamate is an excitotoxin in the brain. So there is this concept that anything processed, basically, she's even going to the point, this microbiologist is saying something like pea protein. So if you have somebody who's really sensitive, these processed foods might be releasing more glutamate from the gut, which is then leading to overexcitation in the brain, which we'll talk about relative to migraines. So that's a very, very interesting point. I'm glad you brought that up.
Well, again, it goes along with the food part of it, but we need to get, you need to tell me a little more of the physiology of the head and the pain and the migraines. Can we get into that?
Okay, let's get into that. And we're just getting lots of great comments on the grilled cheese. I love it.
Go gluten-free with the bread, please.
Right. Okay, so relative to migraines, if you've heard us talk about this before, bear with us. If you haven't, then this is kind of interesting. So most of you have a concept with a migraine that it's a quote-unquote vascular headache. So there's something wrong with the blood vessels going into the brain. The current research shows that generally there's a period of lack of blood flow to one part of the brain. So let's say you're getting an aura. I'm showing you the occipital cortex. Here is the cerebellum. And let's say part of your occipital cortex isn't getting enough blood flow. Well, what can happen is that you can build up inflammatory mediators. Think like if you're exercising your muscles and you build up lactic acid. You know, you're doing a bicep curl 100 times. You're going to get lactic acid in that muscle. Well, the same thing can happen in the brain, where you then develop what's referred to as calcitonin gene-related peptide. You can get high levels of potassium, other inflammatory mediators that do not get flushed out. Now, if these don't get flushed out, what happens is it's like dropping a rock in a lake, or like a shock wave. You can think of it that way. They call it cortical spreading depression, where then, I'm trying to rotate the brain, it's always backwards here, where then this area of inflammation starts to spread out. It spreads outwards like this. And for those of you on YouTube, let's say like this, and it starts spreading out like a shock wave. How you'd envision, you know, like if a bomb was going off or something like that. So that's what happens in a migraine patient. So lots of times that's what's responsible for the neurological symptoms, visual changes, and then as that shockwave spreads, they think that's what leads to the symptoms of a headache. Also, then the brain has a rebound effect where it's trying to get blood flow to the area, which can then lead what's referred to as nociceptive sensitivity. So then the blood vessels start to stretch, and that leads to the throbbing pain. That's the current thought process of migraines. But they have seen in studies that in migraineurs, that the brainstem, which is where a lot of your blood flow is controlled from, lots of times you'll show signs of lack of perfusion even 24 hours before a migraine. So that's really interesting. So lots of times there's this antecedent downregulation of getting blood flow to the brain, starting in the brainstem, that may happen a day before you have a migraine. May not, but they have seen that in research studies. So that's the general pathophysiology of migraine. So why is that important? Well, now a lot of you are being marketed to for different medications. So the new class of medications out there are these things called biologics. We talk about them nearly every week because there's a new biologic for almost every condition out there, from rheumatoid arthritis to ankylosing spondylitis, psoriatic arthritis. Well, now for migraines. So the new biologics are trying to target calcitonin gene-related peptide. So like a Movig, you may have heard of that. A Movig is actually like an immune cell that's going to kill calcitonin gene-related peptide. So hopefully there's less of that in your brain. Also, Emgality, if you've heard of Emgality, is more of a biologic medication, monoclonal antibody, that's going to try and target calcitonin gene-related peptide receptors. So that's important from that standpoint. And then we had questions about MDDS, Kathy. We talked about Maladé-Barkman syndrome last week. And Maladé-Barkman syndrome can be associated with vestibular migraine. So lots of times it depends on where the migraine is occurring. If you've talked to a migraine patient who is like slurring their words, or let's say they can't find the right words, well, maybe if they can't find the right words, they're having a migraine affecting their Broca's speech area in the left hemisphere. Or if your migraine is more affecting your cerebellum down here in the brainstem, then you can manifest as having more of a vestibular migraine pathophysiology. So does that make sense? Any questions? I talked for a while there.
My question would be, okay, I'm very familiar with the bomb kind of thing and the throbbing in the head. Mm-hmm, mm-hmm. I think a lot of us want to know what's going on between the brain and the gut, then, that the nausea comes with it.
Mm-hmm. So in essence, the nausea is there. Oh, looks like, oh boy, it says that we have a poor connection. So we'll pause. Hang with us, everybody, on YouTube. It says consider moving to find a better signal. Let's hope it catches back on.
Technology, you gotta love it.
I know. I thought this was only. Okay, hang with us, everybody on YouTube. Thank you. Well, looks like we got to keep going. So we can repost this on Facebook. So the question is, what about nausea? So in essence, it's actually hard to answer this question, Kathy, because a lot of the research on migraines deals with all this other stuff, and nausea is just kind of accepted as a result of the headache. It's probably because in the brainstem, you have this trigeminal nucleus, which receives all the pain fibers coming into the brain. And so this trigeminal nucleus goes through an area that's close to what's referred to as the emetic centers, which is the nausea area. So there may be some overflow. It's just kind of like, if you get hit really hard, it's not uncommon to feel nauseous. It's probably in part related to that. It might be also due to perfusion factors as well.
Okay. So can we go ahead and bring up the fact that lots more women have migraines than men? Correct?
Right, correct.
So there is a hormonal factor. There is one. I know there has to be.
Yeah, there's a female preponderance. And so with the female preponderance and migraines, there certainly is a well-documented hormonal connection. Hormones affect serotonin levels in the brain. So as we approach the time of menses, in essence, what happens, estrogen levels are dropping. When estrogen levels drop, monoamine oxidases, which are enzymes in your brain that are like Pac-Man for things like serotonin, those can go kind of uninhibited, and then serotonin levels can drop. So that might be part of the pathophysiology as to why some women get migraines more around that time of the month. But it's not uncommon, too, for women to get migraines around the time they ovulate. So these swings in estrogen can affect serotonin metabolism and certainly headaches. So that would be the answer there.
Okay. So when a woman has to call in sick for work, she really is sick. She can't function because she can't stand the light.
Right.
She's nauseous. She has all these things going on. So I'm just kind of protecting my sisters here that we're not making this crap up.
Right, exactly.
It hurts and we're miserable. So the next thing, I guess, would be give us a little more information. Have we covered all the metabolic part of it, you think? Or
not really, no. So, and I'm just letting everybody know on Facebook that we will repost this. So I'll share that now. So, in terms of metabolic factors, so there's a lot of research on thyroid conditions and insulin resistance, on migraine headaches. And so what they found is that there's this weird bidirectional relationship between thyroid and migraines, meaning if somebody develops migraines, they're likely in years to come to develop hypothyroidism. And lots of times people who develop hypothyroidism are more likely to develop migraines. One of the thought processes is that, well, what causes hypothyroidism? It's actually due to the immune system attacking the thyroid. What's associated with migraines? Inflammation. So one current concept on this is that maybe people are developing Hashimoto's, which can be years before you develop a thyroid condition. And maybe that Hashimoto's then leads to migraine headaches. And as the Hashimoto's response keeps going on, then that will lead to eventually hypothyroidism. So that's the thought process there. There are also significant connections between migraines and insulin resistance. So insulin resistance is where when somebody eats carbohydrates, their body will make more insulin for that amount of carbohydrate than they should. And so it's very interesting, though, because if this goes on for 10 to 20 years, then somebody lots of times will burn out their pancreas and they'll develop diabetes, 9.4% of the population. Insulin resistance arguably is affecting like 2/3 of the population. But to be safe, pre-diabetes is like 1/3 of the population. Nonetheless, the insulin resistance phase is associated with migraines. Diabetes is not associated with migraines. So it just seems that like this pre-diabetic inflammatory state, people commonly refer to it as metabolic syndrome because frequently cholesterol is high and blood pressure is high and blood viscosity is high, more likely to have a stroke, things like that. Well, all these inflammatory factors seem to contribute to migraine headaches. So on the metabolic side, Kathy, that's what I would say there.
Okay. So, and we talked about, well, we're talking primary headaches today, the things that just have causes. There's not a medical underlying problem like a tumor or something like that. So we're talking primary today. Mm-hmm. So I looked up and it had some of the primary headaches can be triggered by lifestyle factors. Alcohol, particularly red wine, it says certain foods such as processed meats that contain nitrates. Changes in sleep or lack of sleep, poor posture, skipped meals, and stress, which I think probably takes in, 80% of the causes for primary headaches, I would think. So, I mean, I know the skip meal thing immensely. For me, again, lack of caffeine. Those of us who have to have caffeine, I can get extremely sick by not having caffeine. If it's 2:00 in the afternoon, I'm not had caffeine, there's a headache that you just want to pull your head off. So, I mean, people need to be aware of all these different factors. Some people are, some people aren't. And we've talked about, kind of policing things for yourself, connecting the dots. We just talked about the TV dinners and the processed food. So there's things to look at there. And if you do suffer from migraines or just normal primary headaches without the nausea and the throbbing that you get, that vascular thing, the throbbing, if you've never had that, you're lucky. I have a friend who's had a headache for we're talking like 8 years now.
Chronic daily headaches.
And she did that. She even went to that specialist who went up through her nose trying to determine what was going on in the brain or take some tissue or something. Please don't do that, people. That's not a good thing. But I think we think really probably the best place to start would be with food.
I would argue that. And so there's a lot of misconceptions about food because when people read about this, they hear exactly what you say, avoid nitrates, avoid alcohol, avoid chocolate, avoid cheeses. In my experience working with a lot of migraine patients, and we had some really nice posts this morning on Facebook from, people that we've worked with who've had a lot of success relative to their migraines. In essence, it goes deeper than the foods most people talk about. In essence, the processed foods, think of them as high carb, high saturated fat foods that are so endemic to our society. And even when we think we're eating healthy, lots of times we're eating lots of processed carbs. Those processed carbs do what? They affect our gut microbiome, especially over a period of months, not necessarily immediately. And so as your microbiome is affected, what happens? You're more likely to become insulin resistant. If you're insulin resistant, that's because pieces of bacteria are breaking off, going through your gastrointestinal tract into the bloodstream, poisoning the liver. And so it's not always an immediate process. It can be a slow process. And that's where what I think is happening is we change people's dietary regimens. We start to shift that microbiome. It takes 3 months. And then when we do that, then it seems like the headaches start to calm down in frequency, as well as addressing things like thyroid inflammation. So that's what I would say there. And then we had some other questions. One of the questions I'm trying to remember from Facebook was about someone who takes Phenergan for nausea. And are there any other solutions? Because lots of times the medications used to treat headache disorders are, they're pretty powerful and they can knock people out. And other medications used are Reglan, but I'm not prescribing these from a natural perspective. Some people use peppermint caps, but the question is something like a peppermint cap going to be powerful enough to help somebody in the throes of a migraine headache? I don't know. And that's where, for acute management of migraines, the natural stuff, I would say it's harder to help someone with the natural stuff in the acute phases of a migraine if you're not addressing all these other factors like Kathy was mentioning, from the microbiome to the insulin resistance to the thyroid. All these other things play into it. In my experience using supplements, I've had some pretty neat things happen, but lots of times it's in conjunction with addressing the other variables. So that was a main question. You talked about the nausea, Kathy. One of our listeners posted, can having kids be a source of headaches? And she was more referring to like the stress of kids. And I said, yeah, it's a good one. Yeah. So I love that one. And let me see, I'll try and scroll through here if I can find any others. Any other thoughts on your part, Kathy?
I think is there not an olfactory thing associated with this too? I know my friend and I both, if we're around cigarette smoke, 5 minutes we'll have a headache. I mentioned to you earlier that if I'm around propane or whatever, propane will give me a migraine. So there has to be something olfactory through the nose that goes up and inflames things. That causes this to start throbbing, I think.
Yeah. The olfactory bulb has many connections to different parts of the brain. So certainly people who have chemical sensitivities, it's very common for them to smell something, a perfume, so on and so forth, and all of a sudden they develop a severe headache. So yeah, that is common.
And I think, again, and I know I beat this drum a lot, for people to realize that, yeah, we think, okay, we're strong individuals, whatever, but it does seem like the human body and our stomachs, brains, whatever, there are a lot of things we don't like. Either we have not necessarily an allergy, but, the preponderance to not like certain, like the people who don't do well with dairy, the people who don't do well with gluten. And we talked about, when my headaches got really, really bad in like the late 80s, early 90s, I kept thinking it was pulls in my neck and so forth. I was taking muscle relaxers. And always thought it was a stress or strain situation that was causing me to pull something in my shoulders and my neck, because it was always in my neck. It would go around and just, had that metal band clear around your head. And now we've discovered really that's a food issue for me. It's a nut issue. It's a gluten issue. There's a lot of different things associated with that, but I haven't had a muscle relaxer in forever since I cleaned up my diet. So for those folks that are looking at thinking that it's a physical back issue or a neck issue, and yes, we did talk about the neck has some tie-in with headaches and so forth that comes together. And I think, again, that's that inflammation. You can feel it when that all, just your neck turns to what feels like a steel post. It's so hard and tense. And everybody that has headaches has felt that. But for me to find out that it wasn't because I lifted something heavy and I was getting older and I shouldn't do that sort of stuff anymore because I don't want people telling me I can't do that stuff anymore, but to find out it's food. rather than having lifted a 40-pound bag of something.
Right.
That was huge for me.
Right, exactly. And yeah, certainly agricultural practices seem to change around that time when we were trying to produce mass quantities of food to quote unquote feed the world. And I understand all that. But yeah, certainly a lot of people are talking about that. And just to wrap up, Kathy, I think I probably got to get running because we got patients coming in at 8. But
Okay.
one last thing I want to say is that relative to head pain, remember that head pain goes into the trigeminal nucleus, and the trigeminal nucleus descends down through the brainstem. And actually, head pain in large part is processed in the neck. So using my paper plate example from a few weeks ago, we had this example. Well, think of this paper plate being stacked through the neck, many levels. Well, the first 3 levels of the neck actually are where we process pain from the head. So pain from your neck joints is actually processed in the exact same region as pain from your head descending down from the brainstem into the cervical spinal cord before it crosses and goes back up to the other side. So this is why you see such great attention on the neck and headaches. And there's more and more coming out about this. I got to say the chiropractors are one of the first people talking about it. But as time goes on, you're seeing more about nerve ablations. You're seeing more about Botox therapy, where they're trying to basically paralyze the muscles. Lots of times how those muscles affect the neck and what that does to a headache disorder. So I think your idea, Kathy, is good on us talking about secondary headaches next week, since we lost Facebook and our connection today. But yeah, we'll try and go back through headaches again next week, and then we'll go from there. But I think we covered a lot of the good stuff.
Yep.
Yep. Okay.
Sounds good.
Okay.
Thanks, everyone.
All right. Thank you, everyone. Thank you, Kathy.
All right. Thanks, Dr. Gates.
All right. Bye.
Bye.
Live stream and